Hi everyone, and thank you for joining another chapter of the Rainmakers Striking Success in the Cloud. Today with me is the honorable guest, Oded Shichor. Oded is the leading the health in the cloud portfolio group within Hewlett Packard Enterprise HPE. Hi Oded, and thank you for joining me.
Hi Zev, pleased to be here. Thanks for inviting me.
Cool. So today's session will be about how cloud helps in the health sector. Fascinating topic with lots of value to the entire community. So Oded, maybe we'll start with tell me a little bit about yourself. How did you grow in the cloud domain?
Sure. I've been practicing cloud, involved in cloud use cases and understanding journey of cloud for different enterprises since believe 2012, 2013. Started with OpenStack. I'm a huge fan of open source technologies. In one of my roles within HPE previously, I actually helped large enterprises, global enterprises, to go through that cloud journey and understand what requirements they should have and how to fulfill those requirements using different cloud technologies. Recently, I worked for the past couple of years with large healthcare customers of HPE. Again, understanding their cloud journey, helping those ISVs, healthcare ISVs, to base their solutions on cloud technologies. And it's exciting for me to be in this stage.
Cool,
Yeah.
cool. Cool. So what's cloud? How is it different from telco or something else?
Healthcare is a highly regulated vertical, and it's actually also impacted by different local regulations of each region has its own regulations and requirements. Also, we see a lot of new technologies that healthcare are embracing, and this actually creates kind of a conflict that health organization, health systems, health solutions, ISVs needs to overcome. We see the use of technology throughout different digital transformation journeys of health systems. Health systems are still considered quite conservative organizations. And on the other end, they are being offered different sophisticated solutions to enhance their ability to provide better care to patients. We see also the patient care continuum moving outside of the hospital also to the home of the people of the patients. So that technology adoption needs to be in a much more extensive way, also at the edge, not only at the core or in the public cloud.
Yeah, I assume that moreover now with the pandemic, there is a huge skill scarcity in the health domain, like physicians, nurses, etc. And from other sectors, I know that very often cloud with automation assists to at least somewhat mitigate the skill scarcity. Is that also the case in the health sector?
It is in a certain degree. So skill scarcity is of course characterizing also the healthcare domain. We saw with the pandemic different values that actually digital transformation created and provided to those countries that actually and those health systems that actually went through a digital transformation. For example, machine learning technologies that helped develop the vaccination made a huge use of electronic health record. So companies like Pfizer and other use those the access to EHR systems that they were given to develop the vaccine in a much faster and accelerated manner. Besides that, we can see also in other domains like digital pathology, huge technology adoption. I don't know if you know, but pathology is one of the professions in healthcare where there's always lack of pathologists. On the other hand, only pathologists can actually determine if a person has a cancer or not. So technology helped in the context that different solutions are now introduced to the market to help the pathologist diagnose faster different situations that the pathologist is required to diagnose. So we see a lot of machine learning, a lot of AI, deep learning technologies involved in healthcare.
Is that also including in the X-ray, MRI, CT reading?
Absolutely.
I see. I see.
Yes.
I think I
Yeah.
lately
So
read an article that says that in some cases it's even providing better, more accurate diagnosis than a fatigue physician. Is that correct?
there are evidence, some pilots and researchers that have been done that showed high accuracy of machine learning algorithms functions to diagnose medical imaging. One example of the way machine learning is being used in a more conservative way in the medical imaging is the prioritization of the work list of the radiologist. So when a radiologist comes in the morning to the office and needs to start and diagnose the list of exams and studies that have been created for him or her, basically instead of using it in a FIFO order, there is an AI algorithm that helps the radiologist to prioritize which studies and which patients are the most critical ones to get diagnosed first. So this is another simple, I would say, example of how machine learning algorithms can be used in medical imaging.
Fascinating. And since you mentioned earlier highly regulated market, I assume that beyond of the general stuff that most of the cloud market is aware of, like the GDPR and the California rule, etc. I'm aware that HIPAA is a basic, correct? I mean the health security is that basic for globally or only or mostly North America? How it goes?
So although HIPAA was initiated in North America, it has been adopted globally. There are other regulations as well that are local per each country, but HIPAA is becoming the standard also in other regions outside of the US. There are other local regulations that sometimes actually impact the way of health system can use cloud. For example, in Europe, it is probably more difficult to load the patient data into a public cloud, which is a US
Yeah,
based
data residency
company. Yeah,
regulations. Yeah, yeah, yeah. Cool.
yeah. So
Fascinating. Really fascinating. So, from HPE point of view, what's the latest and greatest? I mean, what's your message to the world?
So HPE has always been in that space of healthcare. So enterprises are the classic customers of HPE that we are working with. We have helped them, deliver different technology solutions on premise at the hospital data center. And today with cloud, we have a portfolio of cloud services. We call it HPE Green Lake, and I'm part of the portfolio management group of that cloud organization. What we do is actually look at the use cases in healthcare, the different requirements of a health system or a pharma company, and we help develop solutions using HPE technology and third parties that we see value in order to deliver the complete service either on premise at the hospital data center with a cloud fashion, in a cloud fashion with a cloud experience, or hosted in a co-location all around the world. One of the latest things that we have started to do with around healthcare is to actually allow hospitals to train machine learning models in a decentralized way. Since we mentioned regulation and compliance, of course, PHI, personal health information, is something that usually hospitals do not tend to share outside of the hospital. That actually limits the way a machine learning model can get trained. What we have done, we've developed using Ethereum blockchain technology and smart contracts, a way for different hospitals to cooperate together in an equal way, equal manner. We call it democratizing the machine learning training process. And what actually is achieved is a much larger data set of PHI data to get to train machine learning models. We use it in other verticals as well, automotive and telco, but healthcare is a classic domain, a classic vertical where we can use this technology. It's available today for pilots with customers. We just published a Nature magazine article on that that people can look at, and I encourage everyone to actually look at it and approach us for getting applied for a pilot.
Fascinating. I assume there are lots of anonymization involved, correct?
Absolutely. When you load data to the cloud, again, depend on the region, etc. But basically, a process of anonymization needs to be involved in order to comply with different regulations and avoid breach of data, etc. Uh, with swarm learning, the technology that HP developed, actually you don't need to move the data, so it actually eliminates the need for anonymization. The data is still kept within the perimeter of the hospital, of the health system, and it's again another value that we provide to that market.
Fascinating. And where does the health cloud meets the 5G revolution, if I can say, in the biometrics and all of that?
Yeah, so different use cases are tied together with 5G, or 5G enables different use cases. Patient monitoring, for example, I just mentioned at the beginning of this session that the continuum of care is expanding much beyond the perimeter of the borders of the hospital, the harm of the chronic disease patients, etc. Patient monitoring can actually be enabled in a much better way with 5G, broadband, video streaming, etc. Hospitals can get indication on patients that are on their way to the hospital, in the ambulance, for example, using 5G technologies. Of course, numerous use cases can be discussed around that.
Sure.
Again, also within the
And,
hospital and
and,
outside
and
the
what
hospital.
about wearables, various wearables like watches and all of that? I mean, I guess there are tons of health data there that goes to the cloud, and AI and ML and DL and all of that. So where does it stand as far as you see?
So, of course, wearable is one of the hot IoT related solutions that we are also looking into healthcare and see how they are getting adopted. So it started, of course, with different devices that actually can monitor the patient basic indicators like heart rate, blood pressure, etc. And pulse. But we see today also more sophisticated wearables. We see also use cases where 5G is enabling a situation where a wearable will indicate if a patient is going to get a heart attack, is subject to get a heart attack, and that in that case we can also see a connection, a potential connection to autonomous car driving, where that patient, if in case he drives a car, he or she drives a car, the car can actually drive directly to the nearest hospital, etc. So different use cases around that are also being tested and examined these days.
Fascinating. That actually bring me to, I think, our last topic here is it's a good segue for that. How do you see the future of health in the cloud and the way that cloud in the near or long future, help extract more value in the health vector, health vertical, sorry.
So one area in healthcare that is highly impacted by the cloud would be precision medicine. Precision medicine is the area where different treatments for patients are being tailored to a subgroup of patients or even to the personal entity, the personal patient. This has to be achieved only by enormous compute power. The enormous compute power is available mainly in the cloud. The cloud doesn't have to be public cloud, of course. It can be also on-premise cloud like HPE provides, but it has to be involved with enormous compute power because we need to run things like genome sequencing and profiling of each molecular profiling of each patient. And this is absolutely the future. One other area that we see in the future is all the non-disruptive surgeries, different ways to act surgeries, non-invasive, sorry, not non-disruptive, non-invasive surgeries, where basically we see different procedures being made with minimal cuts of the body of the patient. This has to be again driven by different machine learning and visualization, advanced visualization, real-time visualizations of the patient during the surgery. All those aspects are being already tested, and some of them are actually being driven already in health systems.
Oded, as usual, I learned a lot talking to you. It was really pleasure hosting you in the Rainmakers, and I encourage our audience to stay tuned for next fascinating chapters of the Rainmakers striking success in the cloud. Thank you very much, Oded, for being my guest here. Appreciate that.
Thank you. I enjoyed very much. Thank you.
Thank you.